How does AMH affect fertility, and does it predict IVF success rates? So AMH is purely a quantitative marker of egg reserve. So what it predicts is the number of eggs we can retrieve in an IVF cycle. That is all. It is not a quality indicator of eggs. So the way we think about AMH is how efficient can we be in an IVF cycle? Just because someone has low egg reserve doesn't mean she will have poor egg quality, doesn't mean she will have genetically abnormal embryos. But if the AMH is very low, it does mean that the number of eggs that we can retrieve per IVF cycle will be reduced. The most common indicator of egg quality by far is age. And then beyond age, there are several factors that are difficult to quantitate. So for instance, we know that cigarette smoking is associated with markedly lower egg reserve. Very high alcohol intake could be associated with poor IVF success rates. Some endocrine disruptors like bisphenol A or BPA that used to be in Nalgene bottles or the like could impact egg quality. And then there's the patient's individual intrinsic egg quality independent of their age. But AMH will not tell you any of that. What AMH is too low to do an IVF cycle? Again, the answer here has some nuance. If a patient has low ovarian reserve, but her fallopian tubes are open, and if she is using a sperm donor and the sperm donor sperm counts are normal, or if has a male partner and the male partner's semen analysis is normal, if we can only get 1 or 2 eggs from an IVF cycle, then IVF stops having as much of an advantage, or even has no advantage, over conventional treatments like ovulation induction or IUI, which is intrauterine insemination. So sometimes there's a calculus between more expensive invasive treatments like IVF and less invasive, less costly treatments like IUI, and you have to look at the advantage of IVF as relates to the efficiency of how many eggs you can get. And if the number of eggs is very low, it may not make sense anymore to spend more dollars or be more invasive with IVF. That being said, if the ovarian reserve is low and the fallopian tubes are blocked, other treatments are not going to work because IVF allows you to bypass the fallopian tubes. If the semen analysis is very poor in terms of concentration or motility, then IVF allows you to do intracytoplasmic sperm injection, or ICSI, where you can inject a single sperm into each egg. And so you need to look at the individual patient factors and their individual goals. If someone has a very low AMH and they want to have 3 children, the only way that they may be able to achieve that family is to freeze and bank embryos for the future so that when they're 2 years older and they could be at risk for premature menopause, we can still get them pregnant if we can go back 2 years in the past when we froze the eggs. So it allows us to have a fertility time machine, so to speak. So just because someone has a low AMH does not mean that they're no longer a candidate for IVF. Some fertility clinics will tell patients that they're no longer a candidate for IVF, but it typically means that they're just an inefficient candidate. But you have to look at that patient's individual fertility goals to help them navigate that landscape.